Hello, welcome again, Dr. Anthony Gonzalez with Miami Community Health. We're here for another important health topic. You know that usually I bring you a physician to talk to you about a health topic. But what about those physicians? Do those physicians have problems? Do those physicians have health issues? Are those physicians well? You know, wellness of a healthcare provider is a very important topic in the last few years. We know that COVID really burned out a lot of healthcare providers, burned out the primary responders, our firefighters, our nurses, and even our physicians. So to talk about physician wellness and wellness of a healthcare provider, I brought the Chief Wellness Officer from Baptist Hospital of Miami. So today I want to really welcome Dr. Ana Rivas Vázquez with us today. And she is the Chief Wellness Officer of Baptist Hospital of Miami. Welcome, Ana.
Thank you. It's a pleasure to be here.
So tell the audience a little bit about yourself and what you do.
Sure. Well, I'm a clinical psychologist, and I have been, at Baptist for the longest time. Both my husband and my late father, my late husband, they were physicians at Baptist. So I sort of grew up at Baptist. And many years, years ago, probably 6 or 7 years ago, at the time, the president of the staff had some concerns because his daughter, a physician also, had talked to him about a colleague that was having some emotional difficulties. And he went to the CMO at the time and said, what can we do? Well, in the fact that I have been the eternal chief of psychology at Baptist, the CMO said, go to Ana or Vicky, which is, my nickname. So I started talking to him. He actually was a very good friend of my late husband. And at the time, I thought, well, this sounds like an interesting topic. And I have heard, in the 90s, my husband talk about how things were changing in the field, how difficult it was because patients really had to follow their insurance companies rather than the traditional relationship between a physician and a doctor. But I never, ever knew how the problem really was. And I was so surprised when I started looking into it and realized that we really had a significant burnout problem. And that's how I started. And it has become my passion.
Yes, I know it's your passion because we hear about it. We hear about you all the time. Whenever there is a possible problem with a physician at Baptist Hospital, we always, is there a burnout problem and so forth and so forth. So what are the qualifications to become that Chief Wellness Officer? How do you become the Chief Wellness Officer?
Well, it was very interesting. This movement really in a formal way started around 2010. There was a lot of work done over at Mayo Clinic. Tad Schoenfeld, became the guru of physician burnout and now wellness, because we really don't like to talk about burnout. Right. We really are trying to go into wellness. So at that time, he went from Mayo over to Stanford, and he became the first Chief Wellness Officer in the country. Wow. And he developed a course for Chief Wellness Officer. And the first course was in 2018. And I was the second cohort. And it was really a fascinating course. It was in a lovely place over near San Francisco, in Half Moon Bay. And we actually got up early in the morning. We started on a Sunday, and it was a whole week from 8 o'clock in the morning until 10 o'clock at night. Wow. And it was really, really fascinating. And the purpose of the course was to develop a program for our institution. So before we went there, we had every month, we had different questions that we had to answer. We had to look at our organization. We had to look about problems that we saw. We had to thought about what solutions, and then we would get a response back. And then, when we went, we worked, and actually, it was so exciting because I worked with Tad Schoenfeld, the program that we were going to do at Baptist.
So by the time you went over there, you went to work on the wellness program for Baptist Hospital. Wow.
Absolutely. And we came with a 3-dimensional model, which the center of it is professional fulfillment. And the other 3 dimensions of it is called, wellness culture, cultural wellness, efficiency of practice, and resiliency for physicians. So it was really, really fascinating. And then one of the things that we were told in the course, they actually select 50, most of them, I think I was the only psychologist actually, they were all physicians. And they select from the applicants. It's a very selective process, 40 people. And I was very excited because I got selected.
Awesome, congrats.
And yes, it was very, very exciting. Now they are on the fourth program. And we actually have an alumni group, which meets 4 times a year.
Wow.
3 times virtually and 1 time, in person.
Wow. Okay, well, that's incredible. And thank you for doing that. And thank you for being a pioneer in that and helping us at Baptist Health. So the silent epidemic, when they talk about this silent epidemic, what are they talking about? I've heard that term. Can you clarify that for our audience?
Yes. The silent epidemic was a term coined by Tatjana Feld. And basically, it really talks about what is happening with burnout in this country. The first big study was done in 2011, and it was done with the AMA, and actually at the time was with the Mayo Clinic. And they found that up to almost 60%, of the different specialties were having signs of burnout. Of course, the people in the front line, emergency department, primary care physicians, these were the people that were the worst. And then they actually did the data again in 2014. And actually, by the way, this was over 2,000 physicians responded to the survey. So it was really,
good,
the end
right, very good.
It was really good. They did it again in 2014, and there was a 10% increase. So that was very, very scary. And then was when, the program started, and, this course started, and most now, all the institutions have some form. At Baptist, we have 2 things. I became the Chief Wellness Officer at Baptist Maine, and there's also the Be Well program, which is at the system level, and we work together. So then, this became the silent epidemic, the burnout, and in physician and in the rest of the health fields, realistically.
Right.
But physicians, because they influence so many people, basically was the one that we had to target, first of all. Because if we basically can help physicians, it would go down.
It would trickle down to the others.
Absolutely.
Wow. So obviously we're focusing on burnout, and obviously we want to know what causes. For the people that are listening to us today, they want to make sure their physicians are not having issues with burnout. And is burnout just because their doctor works too hard? It's just working too hard causes burnout? What causes burnout?
No, I think burnout is the result of a number of factors. We have become a very litigious society, and that's one of the problems. The regulations, the regulatory bodies, impose so many things, and yes, it's for the protection of the people, but still it makes it hard. Physicians have lost a lot of autonomy, okay? The concept of the physician, the solo practitioner, that's really,
doesn't exist. Yeah.
It's gone, okay? We now have the extenders, which is wonderful, and they do a great job. But, it's such a shame, the change that really has happened that is difficult for the physicians. I think as the new generations come around, it might be somewhat easier. The relationship between the physician and the patient has also changed. I remember my husband telling me how, he actually had seen 3 generations, okay? The patient coming in with the child and then the child going up. And that really, because now the patients have to follow their insurance. So the hours of work that are incredible, the lack of control over what they do. So there are so many different things. For supuesto, electronic health record have been a biggie.
Medical record, yeah.
Yes, that has been a biggie. And we really get a lot of help at Baptist with the electronic health records. And in fact, yesterday I was solving a problem with my laptop, okay? And I really got a lot of help. So these are all things, that have happened.
That are causing the burnout.
Absolutely.
It's multifactorial. That's really frustrating the physician. So when a physician starts demonstrating signs of burnout, what are the consequences to the physician? And even, I would expect there's consequences to the patients, right?
Oh, yes. There are consequences at a personal level. There are consequences in terms of the professional level. And they are actually incredible financial consequences. At the personal level, all the way from, depression, anxiety, problems in the family, divorce, alcohol, and drug use. I mean, really,
Wow,
really, really a
sad.
lot of problem. At the professional level, it is, the turnover, the difficulty with the schedules, sometimes really feeling that you don't want to go the extra mile, which is human. And then, of course, financially, would you guess what it costs, to replace a physician that is early retirement? Give me a
No.
guess.
Cost to replace, I'd say $1 million.
Almost two.
Wow.
Yes, because it's the entire process of,
Yeah, of course.
trying to get the physician, onboarding them, the whole thing lost revenue. So it's really, really, really big. But I really want to emphasize something. I really want to basically talk about the fact that we have to try to get away from burnout into wellness.
Yes.
Resiliency is the antidote of burnout. And we really have to talk about wellness, which is what I really want to talk about.
Awesome. All right. So let's talk about it. Let's talk about from burnout to wellness.
Yes.
Because that's the transition,
Yes.
of course. So how do we somebody get from burnout to wellness?
Okay, I'm going to tell you. First of all, first and foremost, we have to accept the fact that physicians are human. We have to accept the fact that there's a lot of stress. And if we don't accept, it is almost, I read this quote, which was, would you expect to walk among water and not get wet? So you are basically walking among suffering, especially COVID-19. COVID-19 was horrendous, okay? We had so many programs over at Baptist Maine. We had so many things we had from well calls, okay, to the doctors when they got COVID, because a lot of them got COVID, okay, to basically training them in different programs. And I have a favorite program that I want to talk about. Okay. To talks about what it was, to coaching, everything, that you could do, it was like the kitchen sink, everything we tried doing. And I really think I'm very happy with the way it worked. So, and we actually, right before COVID, Medscape came out with a survey in 2018, and the figures were starting to drop.
Oh, wow. That's good news. Okay.
Well, it was good news.
Until COVID hit.
Until COVID hit. And when COVID hit, that was a disaster. It was, the stress, it was horrendous.
Yeah, really.
I remember, listened to a psychiatrist in Atlanta at the beginning of COVID, describing the angst, the panic that he felt. This psychiatrist, okay? And it was like, oh my gosh, this is so real. The fear is so, so real. Taking it to your family, okay? The guilt, the frustration of not having the ability to help your patients at the beginning. It really was incredible. But my gosh, you really have to take your hat off to those physicians and those nurses.
Yes, they did an incredible job.
Incredible. I can tell you, the job that they did was amazing. And I have a story.
Yes,
that I want to tell you, a personal story. When I was talking, with this, actually, Dr. Neesonson, okay?
Yeah, of course. I know Ian. I know Ian very well.
He's wonderful.
Great guy.
He was a very good friend of my late husband, Jay Van den Bosch. So when we were talking, about it, my husband, who was this very, very physician first and foremost for everything, 40 years by this time of great practice, really, really a passion for his work. I sent him a patient that couldn't pay. Somebody had sent me this patient, and the patient really couldn't pay because he had insurance, and to do a pro bono. And of course, my husband, okay, who was a big soul, did it. And would you believe that this guy filed an incredible frivolous lawsuit against my husband?
Oh my God.
Okay, failure to refer. Okay, which wasn't true. The records were there. The case really worked fine. Everything was resolved. It was whatever. But my husband was this big Anglo guy. Okay, and he was really very happy-go-lucky. But all of a sudden, it was like, oh my gosh, they had this little gray cloud on top of him. After it was resolved, everything was fine. And you can imagine how I felt. I had sent the patient to him. He had done something good. It was resolved, but nevertheless. Well, he calls me one day and says, I'm not going home for dinner tonight because I'm going to the department meeting, family practice.
Mm-hmm.
And, he used to do that, so it was fine. So he comes home and says, it's over. I'm fine. I said, what do you mean?
Yeah.
He said, it's over. And he had a big smile on her face. I said, what happened? He said, well, I decided I was going to talk with my colleagues. And everybody started talking about what has happened to them. And there was so much support, that I felt great. This is over. And would you believe that it was over?
Wow.
I got my husband back. So
The moral of the story.
the moral of the story is that I thought I was inventing the wheel. And I said to Ian, hey, how about a peer-to-peer program? Wouldn't that be great? Well, guess what? I started doing a lead search. And I found that peer-to-peer programs have been in existence for over 35 years.
Wow.
Women Brigham has a great gold standard. Every institution now has peer-to-peer program. AMA recommended peer-to-peer program.
So explain to our viewers, what is a peer-to-peer
I
program?
am going to tell you right now. I'm going to tell you right now, So we actually said, we're going to do this. And, let me tell you something. Administration at Baptist has been amazing. So one of the hospitalists, that's no longer with us, unfortunately went back to New York, helped me with the first peer-to-peer program that we did with the hospitalists. And what it is a group of volunteer doctors helping other doctors. And we trained them in terms of best practices. They're not doing therapy, but they are learning active listening. They are learning reframing. They are learning, 6 best practices when they talk to a peer.
Wow.
And most important, they also learn, by learning how to help other people, they learn how to help themselves. And, and of course, I was the backup, for the program. And we trained. I ended up training at Baptist close to 80 people in the peer-to-peer program. And I have a dream.
Okay.
You want to know my dream?
Yes, of course.
Okay, well, my dream is that we did the program with the ICU nurses. And there's a clip that they did with a couple of nurses talking about what the program meant to them, which is really a beautiful, beautiful clip. So my dream is that I would be able to develop a similar program that I developed with the hospitalists in the large departments at Baptist.
Okay.
And
we haven't done that yet.
We haven't. I mean, we're in the process of doing that.
We should do that, right?
Yes.
Like a department of surgery for me, we can do it in a department of surgery.
You can help me.
Of course.
Of course.
As chief of surgery, of course I can help you.
That is why I'm bringing it up,
Right.
And really, realistically, doctors have difficulty accepting that they have problems. I can tell you that coming from a family of physicians. I was a medical student, in Cuba, when I was 16 years old and school closed and whatever, and here I am, So they have a difficulty, accepting they have problems, and they have a difficulty basically getting help. In fact, the Lorna Breen Foundation, which was the emergency physician that actually died by suicide, which was a terrible thing, Presbyterian at the beginning, her sister and her husband actually did this foundation. And one of the things that they're trying to do is to take away, the fact that why do doctors don't get help? Well, there's the human part that I am a helper, and I have to help everybody else. I really don't need help, And then there's also the reality that luckily in Florida, we don't have this problem. We solved this problem. The fact that licensing boards ask about if you have had treatment, many licensing boards.
Wow.
There are now 21 states that actually do not ask it, because that's one of the goals of this Lorna Breen Foundation. I mean, many other goals. Insurance companies ask for them. If you actually have a lawsuit, a civil lawsuit, they're going to ask for that. So there are a number of things that actually prevents doctors. And it's very interesting because a lot of doctors don't know that, for example, in Florida, the board doesn't ask that anymore.
Yeah, I didn't know that. Okay.
Yeah, they don't, They only ask if you have a problem, anything that will interfere with your practice. The credentialing hospital, many, many times, there was a horrible incident, I believe in the West, in which actually a doctor was having severe depression and the insurance company make him go to the same hospital where he took his patients.
Wow.
When the doctor was discharged, the doctor died by suicide. So, you know, there are all the things that have interfered, and we're working so hard to try to get rid of those.
So let me ask you, in that peer-to-peer program, are those that are helping, are they have to have been physicians that have had problems with wellness?
No, they're just physicians
that
are
willing to help.
That volunteer, okay. So I'm trying to go to the different departments. I would love to go to your department.
Of course.
And actually talk about, you know, the peer-to-peer program.
Okay.
And how, you know, it is a program in which is physician helping physicians. And all that it is you get trained in how do you notice if somebody's having a problem? What can you do for that person? And very, very important, when is the time to make a referral?
Right.
And how to do that one handover, okay?
So let me ask you, who makes that referral? Can another person make that referral? Can a colleague see a physician having a problem make the referral? Can a patient who wants to help their doctor, who's been with the doctor for years and sees that the doctor's having a problem, who can make that referral?
Anybody can make that referral.
Okay.
I get referrals.
What's the best way to make that referral? Should I confront my colleague and say to him, hey, John, you're having a problem?
Well, that's what I'm there for, to actually discuss with you what's the best way, in this case, to do the referral.
Okay.
So a lot of the referrals that I have gotten to help the physicians have been, you know, through the department heads,
Okay.
which basically they realize that there's a problem. Sometimes, you know, when there is a critical incident, okay, I am calling for the critical incident, and then I talk to the doctors and I say, hey, here I am, you know, how can I help, you know? So there's all different ways of doing it.
All right. So obviously we've talked about burnout. We've talked about how the healthcare environment has changed. We know COVID transitioned this, so, you know, in 2019, 2020. Now the question is, how does a physician maintain wellness or prevent that big bad B word?
Yes.
You know, how do we maintain wellness?
You know something? The first thing is you need to accept that there's stress, okay? And you need to monitor yourself.
Okay.
And then, you know, most important, you need to carve out time every day, even if it's only 20 or 30 minutes, to do something that actually make you feel well.
Okay.
You know something? If you are not well, if you don't have that wellness, the truth is you're not going to be able to help your patient.
You can't take care of yourself first. You can't take care of anybody else. I've always said that.
So
right?
whatever it is, whether it would be yoga, whether it would be reading a book, whether it would be meditation, is fantastic. We actually at Baptist had a program. I was able to get a program for transcendental meditation.
Wow.
And it was amazing. We trained 30-some, you know, doctors in transcendental meditation. And there are some of them walking around that they actually say, this saved my life, okay?
Wow, that's awesome.
So,
so obviously taking care of yourself first.
yes.
Are there any healthy habits? You know, we always hear on this show, you know, about other illnesses because, you know, being well is a lack of an illness, which is great. But, you know, what about smoking, alcohol? What about other recreational?
Absolutely. Your diet, okay, try to have a healthy diet. Exercise is wonderful. Meditation, we have a mini meditation that all that it is, you know, you get yourself in a comfortable place and then you close your eyes and you breathe in and out very slowly and you count backwards from 10 to 0. And you do that 3 or 4 times. It only takes a couple of minutes. And if you do that a couple of times a day, you will be amazed at what that does for you.
Wow.
So meditation, exercise, a good diet, and something, you know, that you enjoy doing. Have a goal, have something. You need to be good to yourself. You know, when you're in an airplane, you have to put the mask first, you know, if there's a problem, before you can help somebody else.
Yeah.
So let's take that analogy and, you know, doctors, let's put the mask on first and then let's help others.
Well, incredible. Thank you so much. So as we finish our show today, obviously you've taught us quite a bit about this silent epidemic that we had, and obviously really focused on wellness because we want doctors and healthcare providers to be well so they can take care of us, right? Because we're patients as well, and take care of all our patients who are listening to us out there. Any words of wisdom you give us finally, and tell us any pieces of advice that you would give our viewers that are listening to us?
Yes, please be kind to yourself. When you're being kind to yourself, you're being kind to your patients and everybody else. It is not selfish to be kind to yourself. That is the beginning of helping other people.
Wow. Well, thank you so much. Well, we've learned quite a bit today. Dr. Anthony Gonzalez here with Dr. Rivas Vázquez talking about wellness. And we're talking about physician wellness, healthcare provider wellness. It's very important for all our viewers, for their physicians and their healthcare providers to be well so that they can take care of you. So once again, thank you. Thank you for everything you've done.
Well, thank you for having me.
Thank you for being our Chief Wellness Officer and really being a pioneer and a trailblazer. And we're going to start going through all the departments now and recruiting for that peer-to-peer program. And once again, Dr. Anthony Gonzalez, on behalf of Miami Community Health, reminding you to be healthy, be well, and take care of yourself and your family.